All right, so thank you for now. Right, for more coverage of the COVID-19 situation here in the country, CHOI MIN-JUNG joins me in the studio. Min-JUNG, good to see you again.
Thank you for having me.
Right, let's start with the growing concerns here over the number of imported infections in recent days, Min-JUNG.
Right, Sunny. While infections in the community are declining, imported cases are hitting record highs. Like Soa mentioned earlier, the country on Thursday confirmed 351 cases from overseas, an all-time high. And what's worrying is that the recent data has shown that 88% of imported cases are Omicron infections. Now, all travelers arriving in Korea until February 3rd must undergo a 10-day quarantine. But given the current situation, authorities say the quarantine requirements are likely to be extended. Scores of cases have also been detected in people returning from the Consumer Electronics Show in Las Vegas. Around 70 attendees have tested positive for COVID-19 as of Wednesday, and given the large number of travelers and with contact tracing still underway, authorities say the number of CES-related cases is likely to increase. Officials stress that those returning from the event must comply with self-isolation rules upon arrival, and they also advised business people with quarantine exemptions to work at home for 10 days after arrival as a precaution.
Right, and just to clarify, we had 391 imported infections on this Thursday, right? Right, moving forward, Min-JUNG, do tell us a bit about the arrival of Korea's first supply of COVID-19 pills.
Well, Sunny, the first shipment of Pfizer's oral pill Paxlovid is set to arrive any minute now at Incheon Airport. As I mentioned yesterday, the first shipment will be enough to cover 21,000 people, and we're expecting another 10,000 courses to arrive by the end of this month. This is part of the 76,000 courses in total that the government has purchased from Pfizer. A logistics center in Chungcheongbuk-do province has been assigned to handle the storage of the first batch, and it is scheduled to be distributed to around 280 pharmacies as well as 89 residential treatment centers and administered as early as Friday.
Right, Min-JUNG, do remind us again a bit about who will be receiving the first pills.
Well, because of the currently limited supplies, priority will be given to seniors aged 65 and over, and also those with weak immune systems. But they also have to be receiving the treatment at home or at residential treatment centers. And these people are first in line because they are relatively more at higher risk of becoming severely ill after infection.
Right, and for the sake of our viewers here, what has been shared, Min-JUNG, about the efficacy, that is, of these treatment pills by Pfizer thus far?
Well, clinical trials have shown that the treatment was 88% effective in reducing hospitalizations and deaths. So the pills are expected to help reduce the number of severely ill elderly patients, as 8 to 9% of people 60 and over develop severe symptoms after contracting COVID-19. And because the pills are designed to stop the virus from replicating inside the body, officials are expecting them to be effective against variants like Omicron as well.
Right, that is good to know. Now, do tell us a bit about the treatment regimen, Min-JUNG, and the precautions to keep in mind.
Well, there are 3 pills in total, 2 pink and 1 white. And people must take all these 3 pills at once in the morning and once in the evening. Authorities say pills should not be split into smaller pieces and should be ingested whole. They need to be taken daily for 5 days, regardless of how their symptoms progress. The government says it will strictly prohibit the resale of any surplus drugs, and those who do will be fined 50 million won, which is around 42,000 US dollars. This also includes the sharing of drugs among family members. If people were to stop taking the pills due to side effects, they will be advised to return the drugs to a public health center or pharmacy.
Right, and staying with side effects, Min-JUNG, what are some of the most common ones linked to this particular drug?
Well, some of the side effects that were reported during the clinical trials were diarrhea, rise in blood pressure, muscle pain, and an impaired sense of taste, but they were mostly mild. If people do experience any side effects, they must consult a medical expert. Patients who have suffered from serious side effects may receive compensation if causality can be established. Authorities say those who are breastfeeding, pregnant, or have serious illnesses should consult with a medical expert prior to taking the medicine. People should also note that authorities have designated 28 drug substances that should not be taken together with Paxlovid, so those who are on medication need to be extra cautious.
Right, I see. All right then, Min-JUNG, as always, thank you very much for the updates and see you on Friday.
Thank you.